Carla. How are you today?
I'm good. How are you?
Good. Well, welcome back. Today's what we call your report of findings, and today we're going to go over your exam findings and your x-rays, all right? And when a person comes back for the second visit, they usually have four questions they want me to answer. The first one is, what's wrong with me? Second, if I can help you. Third, if I can help you, how long it's going to take to fix your problem. And fourth, how much it's going to cost. So we're going to answer all those four questions today, all right?
Okay, sounds good.
Good. So before we go into that, though, we're gonna discuss this guy right here, which is the human spine. Okay, the human spine was designed to protect something very, very important, which is your central nervous system, which consists of your brain, which is encased in your skull, and the spinal cord, which runs inside the spine. And of course, in between these nerves are the nerves that go to every cell, tissue, and organ of your body. We have one number one enemy, and that number one enemy is gravity. Gravity is constantly pushing upon us, and God made the spine in a way for it to protect it from those negative forces. So a normal spine, when you look at it from behind, it should be nice and straight. It shouldn't have no bends, no tilts, no curves. When you look at the spine from the side view, it should have three curves: a curve to the neck, a curve to the mid back, and a curve to the lower back. And when gravity pushes down, of course, all that forces, these curves act like springs and dissipates those negative stresses away from the nervous system. Alright. I have a trivia question for you. You ready?
Yes.
Okay. So, what age do you think this spine will start showing signs of wear and tear if properly maintained from day one?
Over 100?
Good guess. Good guess. But basically, yes. Actually, studies have shown, some research have shown, if you maintain the spine from day one, your spine can actually last 125 years before it starts showing any type of wear and tear. Wow, yeah,
Yeah.
it's amazing, right? So the problem is, we weren't really taught to take care of our spines from day one. I know I wasn't, and I know you weren't. Correct?
Correct.
Yeah. So what happens is, unless you come from a family of chiropractors who've been adjusting you from birth, we do a lot of things that actually harm our spines. Okay. So example, we sit on a computer for 8 hours. We have histories of slipping and falling, car accidents, improper posture. All these things will actually make our spines misalign and lose their curves. And when the spine misaligns, what do we call that? We talked about that the first day.
A subluxation?
Subluxation, correct. So a subluxation can affect not only the spine, but it can affect your nervous system itself. Okay, so let's take a look at this chart here. Well, this chart is an example of some of the areas where those nervous system goes to. Okay, so you see we have the curves we just talked about, the curves to the neck, curves to the mid back, curves to the lower back. And each little dot represents a nerve root, and these lines are showing some of the structures. This is just a tiny bit of the structures where these nerve roots go to. Okay, so if you have a subluxation here up in your neck, of course it can give you neck pain, but it also can give you headaches. It can affect your sinuses. It can affect, it can give you allergies, all right, because those areas are being controlled by those same levels. Subluxation in the mid back can affect the heart and lungs because those organs are actually controlled by those nerve roots also. Subluxations in the lower back, they can affect, of course, low back pain, but also pain down your leg. Can affect your reproductive organs, can affect your colon. Again, those levels control those areas. So subluxations doesn't only affect the spine itself, but also affects your whole general health. Okay, any questions?
No, not yet.
Okay, so now let's talk about how subluxations affect your spine. Okay, so your spine is made up of these bones and disc. Okay, and you can see if the bone misaligns, of course, it's going to affect that nerve root. Correct?
Yes.
So do me a favor. Why don't you put your pinky right in there, and if I do that, what's happening to your finger?
It's squeezing.
It's squeezing, right. So what it's doing to the nerve is squeezing it. So that's going to interfere the nerve that we just talked about. But this misalignment is now going to affect now the disc and the joints and of course the bones themselves. And over time, if these subluxations are not corrected, they can actually start to degenerate and have three different phases. And we have a phase 1, a phase 2, and a phase 3, as you can see here in the models, right? And of course, your spine is not made up in 3D. We have an X-ray. So we're gonna go focus on this poster up here that shows X-rays and shows those three phases. So the first column is normal. As you can see here, the curves we just talked about. Lower back, mid back, and cervical spine. In between are those spaces, which are the disc. And discs don't show up on X-ray. They show up as spaces. So we only see the bone, but those are where the discs are located. So let's look at phase one. And you now, because even though you've never been to school to learn how to read x-rays, what difference do you see between a normal here and phase one?
The neck is straighter.
Right, the neck is straighter, so the curve is lost. Phase one, the only thing you really lose is the curve. So this person's subluxated, this person's sick. Now, the problem is with phase one, it's a very dangerous phase because you don't really feel symptoms when you're in phase one, all right? Unless a patient, I catch them in phase one, unless they come to get checked and I catch them, if we do take them and get them in phase one, we can literally restore that curve in a short period amount of time, okay? Now, most people don't come here in phase one, they usually come in this gray area here between phase one and two or phase two. So now compare phase one to phase two, and what do you see here?
The first curve is completely gone,
Okay.
and in the mid back, it's already touching.
Okay, so you see the spaces are gone here.
Yes.
So let's look up here now and look at the neck. And do you see how these bones are a little jagged?
Yes.
Okay, that's degeneration. Okay, that's the spine degenerating. And now the space in between is actually thinner. That's where the disc is. So the disc is drying out. This patient now in phase two, if we catch them in phase two, we can actually get that curve back in there as close to normal as possible, but it's going to take a longer period of time. Okay. Now, do you think this damage here, do you think that damage, can we fix that?
I think so.
Okay, so sometimes if it's minor enough, I've seen people's degenerative process actually reabsorb, but usually when it's this severe, actually we can't. Okay, so what happens is we actually stop it from progressing any further. All right.
Okay.
So let's say a patient just keeps ignoring their symptoms, covering up with medication, not doing anything about it. Eventually, the spine's going to go into a phase three. What do you see there?
It's just all.
Right, it's totally gone.
Yeah.
Right? Okay, so the spaces are gone because when that disc actually wear out, when bones and bones touch, they fuse. Okay, and when they fuse, that's going to put a lot of pressure on those nerves. This person's going to have a lot of neurological problems. This person's going to be very, very sick. So this person's window of opportunity to get to normal has closed. I can't really do much for this person. We can probably help them a little bit pain relief, but to ever restore their curve, it's gone. Okay, so that's why it's very important for us to take care of our spines for a lifetime. Now, I have a question for you. What do you think my role is as a chiropractor?
To help patients as much as you can.
Okay, good. I am doing that, yeah. But my primary role as a chiropractor is to remove your subluxations and restore motion to your spine. A lot of patients come in here and they think I'm the one who's going to take away their headaches, their low back pain, their neck pain, whatever they're complaining about. But my role really is to remove the subluxation, because once I remove the subluxation, I'm restoring your nerve flow. And when your nerve flow is restored, that means that your body's going to do the healing that it needs to do. So mostly the patient is going to be doing most of the work, your own body. Okay? Perfect. So, speaking about healing, have you ever heard of the 9 months miracle?
No.
Okay, 9 months miracle is every 9 months your cells are replaced with new cells. Okay, so on an average, some replicate a little faster, some a little slower, but on average, every 9 months your cells are replaced. Okay, so let's give you an example here. So I'm going to take my little spine here, and let's say you have a cell, it's right here, and it's getting signals from this level here, from this nerve, and if this subluxation is there, and that cell's not getting proper nerve flow, do you think it's a healthy cell or a sick cell?
A sick cell?
Right, it's unhealthy, it's a sick cell. So every 9 months, this sick cell is going to replicate, make an exact carbon copy itself, and replace it with another one. Okay.
With another sick cell.
With another sick cell, correct.
Okay.
Got it. So, now, have you ever made a copy in a copy machine?
Yes.
And you made a copy of a copy?
Yes.
And a copy and a copy. And what keeps happening every time you make a copy of a copy?
It fades.
It fades, right. So every time this cell replicates itself, if it's not getting proper nerve flow, it's going to get unhealthier, unhealthier, and unhealthier. That's how the disease process works. Okay, so disease, unhealthy cells will lead to unhealthy tissues, unhealthy tissue will lead to unhealthy organs, and that's when things start to happen. Okay, so healing is the opposite way. We're going to start adjusting you. We start restoring nerve flow to that cell. If the cell now gets nerve flow, what's going to happen to it? It's going to get healthier, right?
Yes.
Okay, so it gets healthier, and then it gets a little healthier, and a little healthier every time it replicates itself. That's how the healing process works. Any questions at all? Got it? Okay,
Yeah,
great.
yes.
Okay, so now I'm gonna go over your X-rays, what you're expecting. Okay.
Okay.
I have good news and I have bad news. Okay. Well, of course, the bad news. I think you know what the bad news is. You have subluxations.
Yes.
Okay. The good news is we can help you with. So let's look at your X-rays.